CNS examination. CNS examination should be done in a sequential manner, starting with examination of higher function, cranial nerves, sensory system, motor system, and autonomic nervous system. Examination of higher function is not mandatory as we can get a general idea about it from our routine history taking. But in certain cases, as in patient with altered consciousness, cannot be relied upon to give a proper history of his sufferings. So it is better to start the examination of higher function first before proceeding to further examination of nervous system. The fundamentals of higher function are assessment of mental state, which includes appearance, orientation, emotional state, and intelligence. Assessment of hemisphere, which includes dominance, graphesthesia, and stereognosis. Assessment of memory, which includes short-term memory and long-term memory. Assessment of speech and language, which includes ability to read, to write, and to speak. Keep in mind the functions of different lobes of the brain. The frontal lobe, which controls gross and fine muscle movements, thinking, memory, imagination, problem solving, planning, decision making, and behavior. The temporal lobe, which controls language and speech processing, hearing, memory, emotion, and facial recognition. The parietal lobe controls orientation, mathematical calculation, touch, language like reading. The occipital lobe, which controls vision and color perception. The cerebellum controls the coordination of muscle movements and body balance. The brainstem controls the consciousness, breathing, and regulation of blood pressure and heart rate. Assessment of mental state. The examination begins even before we meet the subject. Look for his appearance from a distance. Introduce yourself to the subject and begin examination by assessing his orientation. Ask him for his name, age, address, present date, and present time. To know about the emotional state of the subject, inquire for his well-being, sleep for its duration, and dreams. To judge his intelligence, ask him a simple calculation like addition or subtraction. You may also ask him a situation like, what will you do if there is a fire at your home? To further judge his intelligence, ask him any question which leads to a sequential answer, like, can you show me the direction to your home from here? Assessment of hemisphere. Check the dominance of hemisphere by giving him a task which requires integration of hemisphere, like threading a needle. Check for graphesthesia by making letters, numbers, or figures on the skin of the forearm of the subject with your finger on the identical areas on both the sides and asking the subject to identify the same with his eyes closed. Check for stereognosis by giving familiar objects to the subjects in his palm and asking him to identify the same with his eyes closed. Assessment of memory. For short-term memory, give 2 or 3 words to the subject and ask him to remember them. For long-term memory, ask few questions from his past like what was your school name? After 5 minutes, ask the subject to repeat the 3 words. Assessment of speech and language. To check the ability to read, give him a sentence to read. To check the ability to write, ask him to write a given sentence. Check the sentence he has written. Also ask him to make certain figures like circle, square, triangle, or a hexagon. To check his ability to speak, show him some familiar objects like handkerchief, mobile, or a watch and ask him to name them. Check for the comprehension by giving him 2-step command. Check for fluency by asking the subject to narrate a story. Check the phrases of the story.